My role is that of a sports medicine and orthopedic specialist, and I principally manage problems of the shoulder, elbow, and knee. One of the things that I always remember is that these are people with joint pain and dysfunction. These are not knees and shoulders that hurt, but they're attached to people who have composite problems that may extend well beyond the initial reason they've come to us. Patients have a lot of misperceptions of their physical problem. First, they think that, hey, if I'm in pain and I have that associated loss of function, if I ignore this, I might make it worse. And an important tenet in my practice is to help people understand the natural history of their problem. Why do you hurt? And if you were to work or function in pain, would you necessarily make yourself worse? I think a lot of patients feel that, hey, I have pain. If I ignore this, I might actually put myself in a situation that I might otherwise not be in if I don't manage it. That speaks to the importance of our ability to make people better without surgery. Despite the fact that I'm a surgeon, better than 90% of what we deal with is non-surgical. To me, that's a home run when managing a patient, helping them avoid surgery. Many patients will come in with an MRI of the shoulder that shows a rotator cuff tear. And that tear may have been there for a decade or more, but they feel that they've just been recently identified as having a problem, and therefore it must be fixed. And what they need to understand is that this is something that has pre-existed and been there for some time, but something may have put them out of balance. And we have lots of ways through non-operative techniques such as injections and physical therapy to re-educate the shoulder to get them to become asymptomatic once again, to get rid of their pain. And then helping them understand that it's okay to have this problem, that neglecting it doesn't necessarily mean they will have additional problems in the future. Similarly, in the knee, we get a number of patients who come in and they're told they have meniscus tears, but they also happen to have arthritis. And they feel that if I do nothing for this, it may become a further problem in the future when they're actually functioning quite well and have minimal discomfort. That being said, if a patient has sufficient symptoms and they've exhausted all means to get themselves better with therapy or injections or other modalities, the use of surgical intervention is largely predicated on implementing the least invasive techniques that have the most likely positive outcomes with the lowest complication rate. And that's really the foundation of our practice.